Hey guys, we're back. It's Ted Bogert with the TED Show. I am definitely excited to have this young man on the show today, Dr. Javier Placer. He's with Specialized. Anyway, it's Specialized. It's medicine we're going to talk about. You can tell me the whole name, Javier, in a minute.
Of course.
I looked down at SPRG and I blanked. We're going to talk about pain management in COVID times. We're going to talk about the services that he offers. But of course, as with all TED shows, we got to get the origin story. We got to learn a little bit about Javier. So
yes,
welcome.
I appreciate the invite. It's my pleasure to be here with you guys.
It's always exciting, and I'm always conscientious of a physician's time. A lot of people feel like, we just had somebody post, I'll share it, I need pain management. I feel like a lot of times people don't realize that doctors are also human beings, and that they obviously got into medicine to help people, and so it's always good to see the human side. So in keeping with that, tell us a little bit about your origin and maybe your journey to becoming a doctor.
Of course. Well, I'm originally from Puerto Rico. I was raised in Puerto Rico, did my training in Puerto Rico as a medical doctor. I completed my residency program, I think it was 2004, at the University of Florida, Puerto Rico, under the Physical Medicine and Rehab Department. After that, I moved to the University of Florida in Gainesville, and I completed a fellowship in spine and interventional pain management. And I've been in Central Florida for the past 14 years. I am practicing pain management and spine care. We currently have two offices, one in Claremont, one in Orlando. Anything else you want to know?
Yes, I want to know if you always knew you wanted to be a doctor or not.
Well, that's interesting. When I was in college, I was an athlete. I wasn't sure what I wanted to do. As a college student, all I wanted to do was play sports. Well, I got injured, as many other athletes do. So it took me away. I had a spinal injury. It took me away for several months.
Wow.
So I underwent treatment, rehab, and that's when I started to get the interest in the medicine. It got me back to playing sports again, and since then it's been my passion.
I love it. But you didn't have plans for that. Isn't that funny how life changes?
No, I did not. I wasn't sure what I wanted to do. So I think it was a blessing in disguise. Yeah.
All right. So before we went live, we had a lot of questions about pain management. So I want you to, and I'll pepper you with them as we go through the conversation. But describe pain management. Why do we want to talk about pain management, and why especially during the pandemic?
Well, pain is extremely common. I think there's about 20% of adults currently in the U.S. suffering from chronic pain. And 40% of them, the pain is affecting the ability for them to function, whether it's at work, at home. So it's very common. I do see patients on a daily basis complaining with the severity of the symptoms. And pain also affects, the sense on how you feel, your well-being. It brings depression and anxiety. And we understand with what's going on right now, the depression and the anxiety, as well as the pain, tends to affect the immune system. So we definitely need that immune system as strong. I believe I read recently that there was a study done in Canada at McGill University, and they were studying the effects of chronic pain in the DNA, and they were able to find that our DNA will get affected by the chronic pain symptoms. So they saw that the DNA, the chromosomes, were affected not only in the brain, but also in the T cells. And the T cells are the cells that we need for that immune system to be strong. So it does definitely affects the immune system. So people that have pain can tell you it does definitely affects the ability for them to function.
It's debilitating.
Absolutely.
I think a couple of people asked this question or wanted to talk about the demonizing of pain management, because people, whenever people would say, well, I need some pain management, you say those words and some people go right to drugs.
Yeah.
And then some people go, well, you know, the most I've ever taken is 2 Tylenol. And there's some sort of stigma attached to pain management. Can you talk a little bit about that and why that is just a bad place for people to think?
I think yes, and you're right. And a lot of patients they don't feel comfortable expressing their symptoms to their primary care doctor or to the family members, because they might people might think that all they want is pain medications. But to understand pain management is much more than just prescribing pain medication. It's understanding what's creating the problem. And you know, as a pain management physician, what we do is we try to address the problem so we can take care of the symptoms. The symptoms are very easy to treat, right? You can write a prescription for some of the patients, and they'll feel okay. But you're not addressing the problem. So when you see a pain management, they will look at the whole picture, and they will try to address the pain so you can restore your function and be able to perform much better in your daily activities.
I think I know for a fact, because my wife has rheumatoid arthritis.
Yeah.
And so the pain that she has to try to manage while she's still a functioning adult, of course, that wears on you. It wears your psyche down. It wears your mindset down, like you were talking about. And so I understand where some people just want that immediate fix to take care
Correct.
of that. But in reality, you really do, like you said, want the long term. You want to address what's happening. You don't just want to mask the symptoms, correct?
I agree. And to understand, there's 4 different type of pain. Like you mentioned, there is the inflammatory pain. And the inflammatory pain is that type of condition that you see it on your clinic, acute, subacute, where patients develop that inflammatory process. And then you address the pain according to what's creating the symptoms. And then there is the most common one, which is what we call nociceptive pain, which is that joint pain. People with arthritis that have that dull pain that tends to affect them more in the morning hours. And we treat that differently than the inflammatory pain. And then there's the nerve pain, the neuropathic pain, that pain that brings that burning sensation, more of a neurogenic component. Patients with herniated disc, patients with neuropathy, peripheral neuropathy, and you address that differently. So it's not that simple. It's really truly an art. You need to identify the problem and then take care of the specific condition that's creating the pain on that specific patient.
Agreed. I think people think about it and they think, well, a Tylenol or an Advil is a Tylenol or an Advil, and that's not the answer. Every pain is different.
Absolutely.
I have Stacy's got the inflammatory joint, very joint oriented.
Yes.
I've got I've got a sciatic nerve problem occasionally. For her, there is no comfort in things like heat or cold. It's like this temporary thing. You have to really know the pain and go to a specialist so that you can address it. Otherwise, you're just trying to treat something because you Googled it. And Googling it is not the answer, folks. But everyone's different. My pain feels better with heat and cold alternating.
Yes. Because your pain is more of that nociceptive pain that, you know, it's more muscle related, and the heating pad helps. Anti-inflammatories might be helpful. Yet, someone that has rheumatoid arthritis, you apply heat, it might exacerbate the symptoms. It can make it worse. So a lot of people tend to self-prescribe the treatments, and they can do more harm. So I think I truly recommend for everyone to see a specialist, because there's ways to really help with your symptoms.
So if somebody comes to you, what different areas do you work? What kind of services do you provide? Tell them a little bit about what goes on at your offices.
Well, right now we're offering pain management, as we were talking about. We do provide services in the outpatient clinics for spine care. I do a lot of interventional procedure, spinal injections, patients with sciatica and spinal problems. We do see a lot of patients coming into our office for that. And we also are providing regenerative medicine, which is something that we can talk about in a few minutes. It's all about providing different type of alternative of treatments for the patient.
Love that. Yes, please tell me about that, because that's fascinating. That's the other side of you Google it, you buy it yourself. It's not necessarily the best way to go. I would much rather have my doctor helping me out with that.
Well, typically when we do procedures, we tend to use steroids. And the steroids is a very potent anti-inflammatory that helps control the inflammation for the patients that have a lot of inflammation, especially in the spine. Well, there's some patients that have some conditions that steroids might not be a good option. Patients with diabetes, patients with cardiovascular disease, patients taking anticoagulation medications. And then, of course, we have read so much about the steroids and the effects on the immune system that can affect the ability for you to fight any type of infections process. Well, we have this option, the regenerative medicine. I use PRP or platelet-rich plasma, which is people probably have heard about the plasma injection also with the COVID. And there's a reason as to why we're using that, because it helps with the healing and regeneration of the structures that we're treating.
Love it. All right. So what does somebody do if they're experiencing the pain? They want to come learn more about what you have to offer and learn more about pain management. It's a big topic, Dr. Placer.
Yes.
I know you hear it all the time. I think people are afraid to admit they have pain, and then they don't know where to go. So they go to a friend who might be a friend and might have stuff that you don't want to take, or advice that you might not benefit from. So I want people to be able to reach out to someone like you, talk to a professional about their pain management. What's the best way for people to reach you?
Well, I mean, they can call us. Our number is 407-499-0755, or go to our website, specializedrehabmd.com. I think we're in the social media as well. So yeah, it's just a matter of call us, get an appointment. I'll be happy to sit down and talk to the patient, explain. I always say that 50% of the treatment is sitting down and talking to the patient and explaining to them what's the source of their problem, so they have a better understanding, so they can also deal with the problem themselves. So I think it's very important with that to sit down and talk to the patient about the assessment and the prognosis on their conditions.
All right. So I told you I asked you a personal question. Don't worry, it's not too bad. I think people, especially with physicians, because there's that interesting gap. People fear you all sometimes. They think you're super. They think you're super people, and you are in my mind. But they think that they're intimidated. So share with the audience what you have done personally, totally aside from work, to stay focused and creative and positive during all of this pandemic insanity.
Well, like I said, it's educating. I think I'm a human being, just like anyone else. After hours, you'll see me on my shorts and tennis shoes, go to the gym and talk about other things with people. So we're not superhumans. We're just people that spend a lot of time studying and trying to help out others. And that's my passion, like I said, just to help out. So during the COVID-19, we've been out there. I provide services to the skilled nursing rehab facilities. With the COVID-19, they've been hit significantly, so they can't really go out and see doctors. Well, my team, it's now going to them. Unfortunately, I got infected with the COVID too. I spent 2 weeks in isolation. I came strong, and I'm back to business, providing those services to those people that are in need.
Excellent. It was a joy to have you on, Dr. Placer. Thank you so much.
It's my pleasure. Anytime you call me, anytime I'll be here.
I will. We'll have to do more in-depth stuff.
Yes, absolutely.
I'd love to have you back on the show.
Sure.
All right. So Dr. Javier, it is Placer, right? Or is it Placer?
It is Placer, correct.
Placer. Specializedrehabmd.com. You can find them on social media, SRPG, I believe. But I've tagged them. And so just reach out, you guys. All of you who messaged me prior to the show and didn't want to come on the show, that was fascinating. There's that stigma again, right?
Yes.
Reach out. He's obviously just as kind and understanding and compassionate as in person as he is here. So thank you guys. We'll see you later. Thank you, Dr. Placer, for coming on the show.
Appreciate it. Anytime. Thank you.
Bye, guys.